This is Willpower.
Welcome, Dr. Dominic Nischwitz. It's Nischwitz and Weitzel here today on the Willpower podcast. Thank you so much for being here with me. I mean, beyond saying thank you for being here with me, thank you for being here for 10 days of me being here with you.
Wow, is it 10 days already? It went so fast.
I know.
It was a great time so far.
It was a great time so far.
Lots of healing.
Lots of healing. So for everyone who's listening, I'm in Tübingen, Germany, and I've been here for 10 days at DNA Aesthetics with Dr. Dome, who is the world's foremost authority on biological dentistry and just a champion of the field and on a mission. I've learned this entire week so much, but you are on a mission to change dental and oral health for the rest of eternity. And that's exciting.
Yeah, sounds like a big mission.
It is a big mission, yeah, and you're up for it for sure. You have enough energy for 6 people, I can tell, so
yes,
you're up for it. I want to open with giving the listeners a little taste of how you got here, and that really is around, you know, what experiences did you have in your younger years or with patients and navigating challenges in oral health that got you to this place where you were like, biological dentistry is, which we'll talk about in a little bit, the difference between biological and traditional dentistry, but what were the experiences that led you to this space? Because it's not always been easy.
Yeah, so mostly my own curiosity and helping me getting healthy. So I had to start early to look for different approaches. Basically, I had to create a new type of doctor that I would have needed 20 years ago, and I mean now 20 years later it's there, so there's not really a name for it. I mean, I studied dentistry at one point, which was I graduated in 2008, so that's already 15 years ago. But even before, I had my own health issues, before I even started studying, or at the beginning, so when I was 20 years old. And then I was interested in training, in bodybuilding, fitness, nutrition, supplementation, biochemistry, all these things, just for me. Just to find the next level. And yeah, never even connected it remotely with my studies. The studies for me was just, I had to do something. I liked it, the craftsman part of it. Was very good with my hands. Not a big deal for me.
And you were seeing it a little in your life because your father was a dentist.
I actually did see it a lot in my life because he was a dentist. He is still a dentist with me in the clinic. But to be honest, I wasn't interested at all in what he was doing because he was never there and not present, not in a bad way, but for me, from my point of view as a kid, he never really explained anything. So for me, it was just, he's just working. And I don't want to do that because I wanted to do sports, skateboarding, lots of things and have fun. And it didn't seem like he had fun, but obviously he had a lot of fun. Yeah. That's why he was always in the clinic. Yeah. So yeah, by chance I was put into dental clinic during my civil service. That's something you have to do in Germany after your school, after you graduate, for 1 year. Even it's either military or civil service. I was at the Red Cross, and then they put me in dental clinic, and I was pulling teeth there, like for people in general anesthesia, not knowing that I wasn't even allowed to do that. But the doctor there thought I was a student, which I wasn't. I still pulled a lot of them.
You were there for civil service.
Just civil service, just watching, and in retrospect, I realized, oh wow, there were a lot of people sitting there, which were students in the 8th semester. They needed to pull teeth to get their signatures and stuff to graduate, but I was pulling the teeth until I probably told them that I was a civil service.
Yeah, and also you said coincidentally or ironically or whatever you said, but it's. I don't think there are any mistakes that you were there in that moment, in that time, and you were like, let me pull some teeth.
I mean, I'm like 19 years old then, and I have no purpose in life besides skateboarding. And then I pulled teeth, and then I realized, okay, I'm very good with arts, I'm very good with drawing things and artistic, and very good with my hands. So I thought, okay, maybe dentistry is it. So overnight, I had to kind of like, entry into university, and they just accepted me, and I didn't know anything. I didn't look into the study. I didn't know what I had to learn. I was just, okay, something with my hands. Yeah. I didn't realize you have to study chemistry, biochemistry, all the medical side of things that in school I didn't like it. I had no idea about chemistry when I entered university. But because I was on, like I said, the nutrition, all these supplements and stuff that fascinated me, it kind of connected. So I realized, chemistry is actually simple, and biochemistry, that's how I think anyways. But I needed to have like a connection with it. Just boring learning it in school wasn't for me, but then with like seeing real life results, it made sense.
So you're chugging along in school and you're doing traditional dentistry though at that point, yeah? You're like going through schooling and to become what at that point is traditional dentist.
Yeah, of course. You have to study and become a dentist. I mean, it's a mixture. It's basically a lot of craftsmanship, and it's important. You have to learn the skills there. But at the same time, you're a doctor. You study with the normal medical doctors, everything, anatomy, physiology, sciences, everything. And luckily, because of my own studies for my personal health, I connected it, and I like to do it, so it was easy for me. But till the last semester, I had no purpose. I was just something missing for me in dentistry back then already. And this is just a moment that I always remember, because I told my dad at like last semester before graduating, I'm not sure about that dental thing, if that's really for me. And I think he got scared, and he's like, dude, it's just your entrance card. And this was the best thing he could tell me, because then I realized, okay, it's actually just my entrance card, and after that, it's what is coming, which is the opposite to most students that graduate. For them, that's final line. And for me, it just started. And my residency was great. I had a super good surgeon that I could learn from, because I wanted to become an oral surgeon straight away. Because of all my studies in the field of nutrition, or what you would call functional medicine these days, or biohacking maybe, I realized I can't do mercury fillings, which my boss still did. Like I found them ugly. They're just black. And then I had to look into heavy metals and YouTube and detoxification, all these things, and a whole new realm opened up for me, which kind of like sucked me in, and I started to go see every single expert worldwide that I wanted to learn from directly. I was just addicted to it. I was reading books and books and books, and if you know me, I only do that if I'm passionate about something. I'm not the book guy, but if I'm interested, I will read everything. Like for skateboarding, I would read every magazine, watch every video over and over again. Same happened then for health.
And I overheard you saying this week at some point that you were reading a book a day.
Probably.
Just during that time, you were reading lots and lots of books on it and diving into it. And then you also mentioned, did you go and study with Klinger? Is that what you said?
Dr. Klinghardt is one.
Dr. Klinger,
Klinghardt is, I learned a lot from him. He was one of my first mentors. He was always, back then he was a lot of times, I think, #1 integrative medical doctor in the US, but he's from Germany. And he had this overall approach, whole body health. And he was always, he's a medical doctor, but he would talk about dental health a lot in his courses. And I didn't know all these things from dentistry. From dentistry, you just learn. Conventional dentistry is a craftsmanship. And you basically learn how to fix bites and smiles, and obviously get people out of pain, and maybe make it nice, look nice. But it's not connected to overall health. It's only going till like the head. It's only for the head. And I was always, like I said, I was fascinated about overall health, probably because of my own issues. And then he was talking already about it, and he was doing research about mercury and heavy metal detoxification, chelations, and was talking about root canals, or cavitations, all these things that I didn't know that they could be a problem. And that fascinated me, and I had to go deeper and deeper and deeper and deeper. And then you go in all the rabbit holes until you read books only about magnesium, only about these things. And this is before 2010. Like, this is a long time ago. But it helped me get a good foundation, and I became a naturopathic doctor, which is called Heilpraktiker in Germany.
Naturopathic doctor,
functional medicine practitioner, neurotherapy, a ton of extra certifications, just because I was curious. Like I said, I was on the journey to find a new kind of doctor to help me, and then always what I learned, I tried to use in clinic and practice and implement and test again, and then use what is useful, reject what is not, and added my uniquely own. And now, 15 years later, it's a complete concept that we're doing. It's an overall health concept that starts with your mouth. I always say that's the mission. Optimal health starts in the mouth, and is not just the technical side of things. It's the melting of high-tech dentistry that we anyways do, as you can see here.
Very high-tech dentistry.
With functional medicine and health optimization, or biohacking, what we do here. There's everything included for whole body health. It's the mouth-body connection. It's just a big thing that is no one's talking about.
No one's talking about it. This is what's so, even just 15 years of more than 15 years now, I've been navigating, what the biohacking industry has to offer, how I can optimize my health, starting with, books on nutrition, much similar sort of background to you, although I'd never skateboard, didn't know how to skate, but just really digging into my own personal well-being and health to optimize my journey along the way. And all of these years, and for many, many years, I don't think we've ever had this conversation, but for many, many years, at least 5 years, I've been following you on social and seeing what you're doing and thinking, this is interesting and I don't understand it. And I also had a very significant fear of dentists and oral surgeons, as we talked about during the course of this week, with past dental traumas that came up with an extraction that was nightmarish. And looking for a biological dentist, the only reason I went and looked and knew to Google to look for a biological dentist in the United States was because of your social handle. And so for anyone who's listening, and Dr. Dome already knows this, I went through a process of finding someone who was an okay dentist in their right, but also was really promoting themselves as a biological dentist. And for me, that just meant that they were working with ceramics. It really wasn't whole body health. I mean, I didn't know that at the time, and this is sort of why everything went down in a negative way. Let's just leave it at that, and gave me a bit of trauma in the oral surgery that I had and all of these things, and how I showed up to your doorstep to say, okay, here's the big question for you, for our listeners. What is the moniker? What's the way that we go out and find someone? Like, if maybe you can just start by describing the difference between traditional dentistry and biological dentistry. It's more than just the materiality.
Yeah, but also maybe you have to clarify that biological dentistry is also, there's no standard for that. Everyone can call himself a biological dentist or a holistic dentist. In Germany, the word holistic is ganzheitlich. It's the same actually, but if you tell ganzheitlich to any normal, good, skilled, conventional dentist, they will initially shut off and say, I don't want to hear anything, because they're usually having a bad rep for the skills. They're good maybe with the sound making and the woo-woo side of things, and that's why I call it biological dentistry here. So no trademark, no standard, nothing. So it's could be marketing. But in a nutshell, there is a technical side of things. So the conventional dentist, like I said, mainly trained to help you fix your bites and smiles. Usually always gets the drill, fill, and bill. Yeah, just a dentist connotation, which is unfair, but that's the way how we're seen. But you need to change that. And what we do is a high-tech biological dentistry, which is, from a technical side of things, just no metals. We look different at root canals. Usually we don't do them or remove them. We do ceramic implants, and we take care of chronic inflammation in the jawbone, and obviously is no metal at all. So that would be the technical side of things.
Yeah.
But this is just level one. So melting this with functional medicine, nutrition, supplementation, health optimization, such as tools from biohacking, hyperbaric oxygen, intravenous nutrition, all these things together make it the BioDentistry 3.0 concept that I'm teaching. And this is a completely new breed. I call them the real biodentists, or real bees. They also practice what they preach. That's why real bee equals be real. So they need to change their lifestyle, start with themselves. I mean, you've been here and you met 2 of them already that start with their own health, with their own surgery. Because I think we need to practice what we preach and walk the talk, just in order to help our patients on the same journey. Otherwise, it feels like a disconnect. And
a big disconnect. I think there's a big gap between what we are hearing from our dentists or people who are working on our mouths. As I mentioned to you the other day, the people who did my surgery, even though it was pretty intense in 4 hours and I was in a lot of tears, I went home and the next day there wasn't much follow-up. And here it's been a completely different experience. So part of the biological or the BioDentistry 3.0 experience is that from 2 months ago, I got videos and information and a nutrition plan and supplementation to really prepare my body for the surgery that I went through, and then all the way through the surgery, which I was awake for, which I could not believe. Even smartly, no one told me I would be totally awake for it until I got to Germany, because I think I would have worked in my head this whole story about fear and I should go under and how is this going to work. And I'm so thankful that I could be, obviously I'm numb, but that I could be awake, because you talked me and you even talked my body through sort of the process of things happening during the course of surgery. So really setting everybody up for success. So I want to know, do you want to speak a little bit to what people can do to sort of preventatively be taking care of their mouth and their smile and prepping, their bodies in general for health, but also to how you instituted this protocol and how it's received by people here.
Yes. So you mean people in general, so that they don't even need dental repair at the first?
Well, that's the end game, right? That's the goal. Maybe you don't need dental, let's get to a place where we get our teeth as healthy as possible, and then we navigate anything.
But you mean how to prepare, how do we prepare? So basically, the idea is that we want to support the body before any sort of treatment in the mouth, which could be a surgery, usually is a little bit of a surgery, or removal of anything, because your body is the one doing the healing. It's not me, it's just me helping you heal. But if you're in a state of, let's say, I always call it hibernation, your body is in a depleted state maybe, or more catabolic, meaning you don't have enough nutrients to support healing afterwards. Then you have more swelling, more pain, less bone healing, less systemic health. Therefore, we start before, like you did 6-8 weeks prior. I mean, you're already a biohacker and you know your nutrition, everything. I wouldn't need to tell you anything, but the general patient doesn't know about these things. They don't even understand that teeth are part of the body, usually even the dentist, and that if you have problems with your teeth, is a sign for overall decay, not just tooth decay. So we support with the food design concept, nutritional support, as well as the right micronutrients that help your body be in a surplus. Like I said, it's to be anabolic. Your body should be able to build tissue and repair. And then obviously you have less pain, less swelling, all the things possible, and heal from there. So that's why this is a big part in the teaching. And this is also why, in my opinion, the real biodentists, they need to practice it themselves. They need to know exactly about nutrition, how to get them in good health and then good shape and all these things. It's all the same. But this is not heard of in dentistry.
Yeah, and especially in the States, and I think this is what's so exciting also, because I'm a nutrition specialist, I'm coaching people on nutrition, but even when I got your protocols, it was like, great, I'm 85% there, and then, we all have moments where we're like, well, I'm a little off here, and I haven't been managing this well, and then it really just reaffirmed or re-upped me into, okay, let me level myself back up to that 100% clarity so that I could feel better and be giving myself the nourishment I needed coming up to this trip, right? Including long-term travel, long-haul travel, right?
Yeah.
So wanting to make sure that all of that exists. And then, and then working through the 10 days of me being here, having IV treatments and hyperbaric and all of that really just helped continue along with all these protocols. So it's been beautiful.
Thanks.
The one thing that came up with a couple people that I've been speaking to, and they're like, what did you exactly do in your surgery, Kristen? I want to hear more about it, is this term that you use, cavitation, which is, I had 4 cavitations removed where my wisdom teeth were, but I know that this is a layman's term and it has encompassing of several things, and I think it's something to really share with people about what might be going on in the body under the surface that is creating inflammation and whatnot. So can you expound upon the word cavitation and exactly how you work in that realm? Yeah,
that's the layman's term for a medical condition known as FDOJ, which stands for fatty degenerative osteonecrotic jawbone. Basically dead bone, dead mushy bone in your jaw. Silent inflammation, or is also NICO, neuralgia-inducing cavitational osteonecrosis. So it's boring terms, maybe people don't really get it, but this is the medical word for it. Problem here is, this is a part that you do not learn in dental school. So it's not taught. So even for dentists, if they hear me talk about this, they're probably saying, what a charlatan, what a quack right there, because it's just unknown, even though there's a lot of studies about it. And there's one specific guy that I always need to mention, because he's the Yoda of cavitations, is Dr. Johann Lechner, actually from Germany. He's almost in his 80s, I think. And for the past 40 years, that's been his mission. He has so many research papers out there, but it's always a battle between him and another professor from a university. So it's all, it's not, he does the evidence, but the other one is the eminence. So he's like the king and he shuts it down all the time. So it's only a matter of time. But for you guys out there listening, I'm always asking 3 questions actually. But one question would be, have you had your wisdom teeth pulled? Kristen had her wisdom teeth pulled. So I instantly think, okay, she had her wisdom teeth pulled when she was in her teenage years, like most of you guys listening in. You probably weren't prepared with the right nutrition, probably didn't have enough vitamin D3, K2, all the things, maybe even had party and smoking and drinking. What do you do in teenage years? So I'm initially thinking, okay, she probably didn't heal that. And then to confirm, obviously, we do a 3-dimensional X-ray, which is called a cone beam scan on site, where I can then see, oh, literally there's no bone. That's only what I can see. And because I've done these surgeries for more than 5,000 times, probably 10,000 times, I know there's usually fatty tissue in there, and this is just a chronic inflammation that is in your jawbone now for 30 years. Producing cytokines, chemokines, is a breeding ground for bacteria, viruses, fungi, parasites, even glyphosates, mercury, all the stuff is in there because it's kind of like dead for your body. So if we find that, that could be a huge trigger for any sort of chronic health issues that you might have, from mental to physical. It doesn't really matter. The usual suspects could be skin issues because it's directly connected to the heart and the small intestine, SIBO, small intestinal bowel overgrowth, thyroid issues such as also autoimmune issues like Hashimoto's, what is usual suspects still, like mental health issues. Anything you could come up with could be connected. That's the only thing I'm actually always bringing to the table. Don't forget to look into your mouth, and especially these cavitations. 99+% of all the dentists won't even diagnose because they don't even know about it. Or will tell you that's completely BS.
Yeah.
Right? Did it come clear?
Yeah.
What I say?
No,
Okay.
absolutely. I was, as you're saying that, there's been moments in your career, this is like more and more people are finding about your work and biological dentistry in general, but it's like, overnight success, 15, 20 years in the making, it's that typical story. And so I just wonder, you were telling me the other day about one of the more challenging experiences you had here in Germany where people came to you and said, hey, is what you're doing legit, or like there's a disconnect, or dealing with sort of people in society saying, this isn't real, this is BS. Like, what are some of the more, is there something you've gone through that's felt like the most challenging moment to really say, I have to stand on the mountaintop and tell more people about this, and how do I stand for myself because people aren't listening? Let's just speak to that because I think that's important, which is cavitations and how long is it going to take for it to get into society, and understanding that these things lingering in people's bodies can create a multitude of symptoms, right, throughout the entire body. Yeah,
systemic health issues.
Yeah.
We actually know already, at least in functional medicine or more integrative medical things, that chronic inflammation in your body is stress, and this is usually the breeding ground for all the chronic health issues. Also the bad diseases later on. So every medical department would love to know if there's anything chronically going on. But if you don't know that something in the jawbone could be a problem and is even existing, how can you find out? That's the problem. And there is a lot of research out there. For example, in these cavitations, you have a specific chemokine, you wanted to touch that, like the more nitty-gritty things. It's called RANTES, RANTES. Or you could also call it CCL5, chemokine lignin 5, would be the medical term for it. This is overexpressed in these cavitations. It's nothing bad at the beginning, but it just means it's an ongoing construction site. And if it's on for too long, it flips and can create all sorts of problems or be connected. So there's studies showing that this chemokine could be contributing to breast cancer, could be contributing to multiple sclerosis. So if you type in Google Scholar and, for example, multiple sclerosis and RANTES, or plus CCL5, you will find a lot of papers. Here's again the disconnect. The dentist doesn't know that it's existing unless he was trained, but not in dental school, from me, for example. And the medical world is looking for it, but doesn't know it's in the jaw. So that's the problem. If you can connect this, that the mouth is actually part of your body, that is biodentistry 101. It's the mouth-body connection. This is the narrative we should use also as dentists for our patients to understand. This is the entrance hall. This is the lobby of the hotel. If the lobby is shitty, you usually go out, right?
Yeah.
So if the lobby here is not good enough, the rest of the hotel is your whole gut system. That's just the beginning. And if you understand that there are things that you might not even see, that you need to look deeper, have a 3-dimensional X-ray, and look for chronic inflammation, chronic infection, toxicity, cytokines. And if you just understand functional medicine a little bit, or biochemistry a little bit, you understand, oh, there's TNF-alpha, there's interleukin-1, overexpressed. Oh, we understand that this maybe reduces your growth hormone, this maybe causes havoc with the female hormones, or the male hormones, this lowers your testosterone. Then you get it. You have to understand stress axes, like the pituitary, hypothalamus, adrenal glands. This could be all triggered by the mouth. Could obviously also be triggered by your elbow. but the mouth is the part that no one looks at. But the mouth is the extension of your brain, so it's really your central nervous system. That's the computer there.
Yeah.
So it's way more important for your body, this part, than the arm. Even though for you, maybe the arm is more important than your jaw.
No, but I went down the rabbit hole last
Mm-hmm.
night, I said to you, and I looked at when we're an embryo and how we start, and we form from this flat two-dimensional thing to a tube, and then the teeth are inside that tube, like the cells that build the enamel of the teeth are in that tube, and then it's like it's almost like your teeth are coming from your brain, and the whole body forms around it, and it's so... But none of this I knew, right? Because my dentist would have never explained it to me, and I don't have any... I didn't decide to have capacity to research it before this moment in my life.
There is again a disconnect also in university. You're learning all the medical things, but you're still the technician. So we have to really, this is the mission also for the dentists, that we have to change from a technician to a physician. This is what the BioDentistry 3.0 entails. It is a completely new breed, but it's not against conventional dentistry, not at all. It's just the next level. It's the dental evolution. So if you're up and open-minded for that as a dentist, usually they are coming right now. It's still a pioneer phase right now. I thought it was me pioneering 15 years ago, but still.
No, it's definitely
still pioneer
now. And when we use this term in America a lot, that you're disrupting a category. And I think it can have an interesting connotation to it, but just disruption in a positive sense, like it's shaking the trees to say, hey, things need to change. Now we know so much more. It's time to level up all together collectively, which is so much of what you're about. You've said to me more than once, I don't want everybody to have to fly to Germany. I want more people doing this around the world so people can get healthy. And I want you to speak about this disruption, because you've said there's been a couple eras of shitstorms in my life over talking about, conventional dentistry and biodentistry, and just to speak a bit about how you navigated those, because they couldn't have been easy.
No, it's not easy. At that time, it's not easy because I'm not trained that way. I'm just interested in people that are successful. I was always looking up for hanging with those people because I felt, okay, great, they can make it, so I can maybe too learn from them stuff. So I was not in an envious or jealous world. So for me, obviously everyone is then the same. Like let's say 15 years ago, I thought, okay, if I find something new, everyone will be interested. They're just naturally curious, more like a kid, passionate about things. So imagine me coming on stage, only 30 years old, big audiences, and on dental congresses, and I would give a speech about root canals being a health issue, and I would get attacked on stage. I would just present for 30 minutes, but then after 30 minutes emotional talk, basically spitting at you and completely, wrecking you a little bit. So that I didn't bother too much. I was just to my wife back then, I was just this is not too much fun. I don't want to do that, because I was already starting to train people that are more interested. So I realized, okay, you cannot criticize your colleagues, you just inform them. I started this, but then I wrote a book, which was that was the hiatus of everything. I wrote a book in German called In aller Munde. It's also in English, it's all in the mouth.
It's all in the mouth.
Yeah, exactly. It came out in 2019 in Germany. And back then I didn't have really experience with the press. But obviously in my hometown, there was someone with a book, so they wanted to have an interview. And I obviously gave an interview, and I just told them from my past experience, please do not criticize my colleagues, just inform. Write it that way. But I didn't double check. I didn't know that you used to proofread or sign off on anything. So I just let them go.
For the article, you mean?
For the article, for the newspaper. And I was on vacation actually when the newspaper came out. And the title was great. It was like a dentist that hits a nerve or something like that. But below, the subtitle was basically saying Nischwitz is criticizing all his colleagues and dental university worldwide, so to speak.
Oh my God.
That ended up in a lot of shitstorm. My office was calling me from morning to evening. There's people calling in, and there's all these letters to the newspaper, and these are colleagues, and the university is coming after you, and this and this and this. And it took a while, and became a big thing, let's say nationally in Germany. At the end I had a love letter in every magazine from all professors telling,
that's nice.
Writing that is complete bullshit what I'm writing, because root canals are amazing.
Oh, wrote, you said
a love letter was an exclamation mark. Yeah, more like
not
a hate
really
speech.
A hate letter to you.
More like a hate letter, yeah. But I realized then, actually it was great that I had these shitstorms, because I could also see the outside perspective and also learn what I did wrong. Me being just naive, just thinking I can help everyone by bringing change, but I realized, okay, the biggest fear for most people actually is fear of change, and I love change.
Yeah.
So I'm not saying that what we do right now is the best, I'm just saying we try to be the best, but if there's something new coming up tomorrow, I'm like the first one to adopt it and try and use and see if it can fix it in.
Yeah.
So I don't say that a ceramic implant is the best option in the future. The best actually is your real teeth, but you know what I mean? Like, I'm always staying curious, and I thought most people are the same. They're not. So I learned this, I realized, okay, I just have to dial it down a little bit and talk to the right audience. That's when I started to actually kind of leave Germany, start speaking English, because it felt like a glass ceiling here. Mm-hmm. And in Germany, the mindset is usually, successful people are not really cheered on. It's more like jealous you have to earn mindset. It's really negative. Mm-hmm. Versus I felt in the US, it's more like, oh, successful people at least get a little bit of like
or there's
cheering.
Maybe a growth mindset, and
more
people
growth
are like, hey,
mindset.
tell us more about what you're doing, and we want to hear, we want to learn.
It makes sense. So I started this, and I started to stop speaking to dentists, but only speak to the public. Like, the book was written for the layman. I basically wrote it for my mom, so that
and
everyone
it's in English for anyone who's listening, right? It's all in the mouth. It's in English.
Exactly. It's not a medical textbook, because medical textbooks are very boring.
Yeah.
So it's really kind of like a thriller. You just read it as whatever, super simple, explains the whole concept. It's all foundational in there and talks about nutrition, all the things. So people received it quite well. And this is now, again, 5 years later, or even 6 years later, and the shitstorms are quite okay, because I realized they either hate you or love you. They will never all love you. It's all fine. Yeah. But it gave it a little bit more traction. And then COVID hit back then, like a year later. And this accelerated the whole global health transformation, in my opinion, at least what 100%. I see. 100%, right?
Yeah. Yeah.
So now, 5 years later, 50% of what I was criticized for in the book is medical guideline in Germany. So doing ceramic implants for a decade now, 5 years ago was still, he's doing bad things for your patients, they don't work, whatever. He's taking out root canals, but now ceramic implants is medical guidelines. So you have to present it to your patients as a dentist. If you don't, now the dentist is screwed. Right. So now obviously they have to come and change. So I was
patients
just
have
too
to
early.
Be given all options here now, yeah.
They have to. This would be regulations. If you don't do it, it could be a problem. So it doesn't change because of a health perspective for the material. It's just more an aesthetic thing in dentistry. But a ceramic implant is white, and it is neutral to the body, and you could use it to just restore something that is missing, and at least do not create any chronic inflammation or joy. It's obviously not the best thing, because the best thing is always your healthy, new, vital tooth. But if that ship has sailed, we want to give you a solution. And then a ceramic implant is actually perfect, because it's a biomaterial versus the regular dentist does a titanium implant. That's the gold standard still. Yeah. But it's a metal. And a metal in this world you cannot really implant into jawbones. Even the medical guidelines for titanium implants, they say that at least 40% of all patients with titanium implants develop a chronic inflammation in their gum around it. And 20+% develop a jawbone inflammation called peri-implantitis. That's in the guidelines. So I'm thinking, wait a second, we know that this material, it's not ideal, there's better stuff, why not just do the new stuff? And I mean, we also change our iPhones or phones every 2 years because they get better, right? Yeah. Why would you not change a technique or a tool that you use for 40 years and then adopt a new one? That's how long it always takes in the medical world. Yeah. Now it's coming. It's still only 0.8% worldwide that do ceramic implants of all implantologists, but it's changing, hopefully, because all the big companies obviously smelled that they need is a white implant. Yeah. I mean, if I would have given you the option, choose a titanium gray screw, or do you want to have a nice white one? Yeah, which one do you choose? As a patient, would you?
Yeah, of course.
I mean, there's maybe some people that would love the metal one. Like if you love the metal and titanium, you want to look like Terminator underneath. Yes, the endoscopic skeleton underneath. But if you just look at it rationally, no one would choose anything else. If you then know that this stuff doesn't cause chronic inflammation, it's neutral, the gum loves it and grows back on top of it, I mean, there's no side effects to it. Why not? Right. Why not change?
It's the right answer.
But sure. It takes so long, and you have to always go through that phases of I mean, with 30, you get ridiculed, like they laugh at you basically, and then you get fight on, that's the shitstorm time, and then you win, and it's finally there, you don't get praise for it, no. It doesn't matter.
It's like, oh, it's always been like this.
Exactly, at one point it's like, what? But it's fine, I told you, it's not about me, I'm just the PR agent maybe for that mission, the spokesperson and the trailblazer, but I wanted to make it big for everyone because it will help millions of people out there reaching optimal health. Yeah. They're suffering. You know, chronic health issue is the epidemic of the 21st century. And this is for 20 years plus. It's not from overnight. So we are getting, 70% of all Americans are obese or overweight. That's insane. Yeah. Then we have tons of other chronic health issues, like I just mentioned. Could be neurological issues, Alzheimer's, Parkinson's, ALS, cancer, all these different things. It's just a disease state, dis-ease, but we have to find what is the epigenetic trigger? And this is great for biohackers and health optimization because you do so many things. You already optimize every area that you can, but the mouth is something, if there has been any dental repair or anything dentally done, you cannot biohack your way around it. It's not possible. You need someone skilled, trained,
to go in and make the adjustments,
and just turn the time back because you didn't come to this earth with like a titanium implant or a root canal or pulled wisdom teeth or any cavities, right?
Yeah, and when you look, if you go into my mouth and you look into my past history of anything that was put in my mouth that was metal, my body rejected it at some point. Even the last ceramic, I think the last ceramic that I got done in Los Angeles fell out, rejected, because I think there was so much trauma around that whole experience that my body was like, I don't even want this in here. Maybe. The thing that's also, I have a friend of mine who talks a lot about the future of our health is not so much like what we put into it as much as with some of the things we take out. And just from that perspective, people are listening who may be sitting, listening to this podcast or watching this podcast who have amalgam metal fillings, who have titanium posts in their mouth. Like just to reiterate, like what's the issue with the metal and what are the options for them to be able to take those out? Yeah. So, basically in a nutshell, just to ask again 3 questions is, you just touch on the metals. So ask yourself as the audience the question, do I have any metal in my mouth or have I ever had that? Are there any root canals? And then the cavitation part with the wisdom teeth we already touched on. So metals are just something we use in conventional dentistry to restore your bite. And maybe 100 years ago, there was no other option. So mercury fillings came in about 200 years ago. Back then we only had gold. And already back then, when they started these mercury fillings... Gold would have been better, probably, right?
Gold was the initial one. Gold was quite okay, but took a long time because they basically hammered these tiny gold fillings in your teeth. Mm-hmm. So those were the American Association of Dental Surgeons. They did this. Then these French dudes invented mercury fillings, amalgam fillings. And they could just do, instead of 1 a day, 20 a day. But the dental surgeons already realized, oh, my patient's getting health issues. Is that maybe connected? And they basically banned it or forbid it to their dentists to use mercury fillings already, like 150 years ago. And the ones that didn't listen and just had more money making it, because imagine you can do 20 a day or 1 a day. It's just also a bigger business. They won, and they created the American Dental Association, which is the biggest biggest association for dentists. So they won over the surgeons, even though we realized quite soon that there could be health issues. So it's always just material focus versus optimal health. So a mercury filling, it says in itself there's 50% mercury in these black fillings. It's not silver fillings. They were marketed as silver fillings up until 2018. But there's actually just a tiny bit of silver in it. They look a little bit silverish. That's 50% mercury, and mercury is the most toxic non-radioactive element known to man. I personally, in the clinic, every dentist, we have to remove it after we take it out of your mouth. There's someone coming in, removes it as highly toxic waste. But in the mouth, it seems to be quite okay for patients and not toxic at all. I was wondering that in the...
You're like, what's this about, right?
Yeah, that was my first...
The hazmat suit is coming to take out the mercury fillings, but they're in your mouth for 40 years, exactly.
Exactly, and then you learn about all these things I was curious about that. I couldn't do them because of aesthetics. But then I looked into, they're very unhealthy. How can we even do that? So aesthetics usually are... For some reason, we like it, we're attracted to it. And if it's not so aesthetic, maybe for a reason. So that made me curious, and I realized, okay, we cannot do this because it might cause problems. And if you go into the literature, mercury is not the single number one killer for everything. That would be wrong to say, but mercury could be a trigger connected to all health issues that you're imagining. So you can't prove any causation, but correlation is big. So in my process always, how can I help my patients reach optimal health, which is not absence of disease, which is optimal health, not a 0, but a 10 out of 10. So obviously, do I want mercury fillings in my mouth or for my mom or my wife? Obviously not.
No.
So then I have to learn how to remove them safely, because I know by drilling them out regularly, I will create more chaos. So it's completely correct that mercury fillings, when they're just placed in your mouth, they release a tiny bit of mercury. It's not a lot. It's maybe 2 to 3 micron per day. So it's millions of a gram. But if you drill them out without safety, you maybe produce like 100-fold, and that can cause huge problems in your system. So that's why I always say, don't freak out when you're listening to new information and you have these fillings in your mouth. Just know they might be a stressor to your system, but first of all, find someone who is skilled to remove them safe, like a real biodentist, or someone who is trained and is a smart certified dentist. That means safe.
Smart certified. Yeah, that was something that you had shared and sent with me about that.
Yeah, that would be.
Where people are checking in on all the ways they can find people who are going to do good work, because it's very hard. I don't know if it's as challenging here, but in the U.S., everybody's got a great website and everybody says all the most amazing things, and then. So I think a lot of people, it's like also finding referrals from people who, because you've worked on Shawn Wells, you've worked on Tim, you've worked on lots of people. So the very last effort for me was to say, okay, I've been following Dome for so long. I've been seeing this work. I believe in it. I've read about it. And now I could go to, Shawn and just say, am I going to be okay when I go there? And so this personal referral really is like sort of the last thing. And it took me years to advocate enough for myself, right? I started by Googling, where's a biological dentist in California? And then all the way, cut to 5 years later, now I'm here. So we really need to advocate for ourselves, because it can, if I talked about the money that I spent and doing all that work to have a trauma to then everything fell out and failed, I mean, that's just, it's like, if I could go back, I would have just come here right away. But you don't know what you don't know. Yeah, you don't know what you don't know. So this is why we're doing this podcast, to remind people that you can advocate for yourself, so you can find people. And absolutely, like if you can come to Germany to get the work done, but this is also why your work is so pivotal, that Dr. Dome is out here not just treating patients. He's out here with a mission to certify dentists. So if you know your dentist has a little bit of a growth mindset, and I've already heard from 2 dentists while I've been out here saying, can you send me more information? My husband and I would love to do this in our practice, like a husband and wife that have a practice.
Nice.
This is the future of dentistry in such a way. So
it is the future of dentistry. That was my last talk. Welcome to the future dentist. Yeah, it is.
Yeah.
I just thought it's more in an early adopter stage, but it is in the pioneer stage still. So it's like 0 point percentages of all of us dentists, and there are thousands of, probably
hundreds of thousands,
maybe even millions. I think we already have 75,000 dentists only in Germany.
Wow.
You probably have almost 1 million of dentists in the US. So worldwide is a lot.
Yeah.
Imagine, this was my thought process. So before I even went on social media for anything, I already had that clinic running. And patients were already flying in from all over the world because of these personal referrals. Mm-hmm. So I would have not needed to do this for me. But I have this strong feeling that we all together can change something. And I wrote this online course that I'm now teaching. I wrote it initially 4 years ago. And then I put it aside because I didn't want to work with dentists anymore. I had no fun.
They were too angry at you.
I felt like, no. Yeah, they were too angry at me. But then actually on social media, as I grew and grew and grew for the reach, I had more and more DMs coming. Where can I learn this? How can I practice like you? Like worldwide, globally, everywhere. So I finally said, okay, if I'm not going to do this, no one does it. So let's create a new standard. And obviously this is a platform that just begins and it's growing. But we need to first, as dentists, speak the same language. And this is the software update, what I always say. The software means my teachings of the past decade that I did offline are condensed into like a 12-hour program that really gives us all. And then, as you've seen, dentists fly in from all over the world and look what they can build and take from here and copy and paste. Because back then, I just calculated, I can maybe do 30,000 surgery with my own bare hands, help 30,000 patients. It's nothing. But if we train 1,000 or more, it's 30 million. So if we even train more, it could be millions and millions of people, and it actually doesn't affect anyone in a negative way. So regular conventional dentists, if they just completely understand it, what I'm doing, and don't get emotionally triggered, they will all say, wow, it's completely different. I don't have the numbers game anymore, doing like making ends meet by doing 50 patients a day. You saw it. There are not too many patients here. Right? It's like
no, because everybody's so cared for specifically, and this is also like if this is the future of business, it's also like this is a way to expand business so that people can continue to make the same or additional income streams and spread a message of health.
Yes, that's also always a question that you get. Like, this is a proven system because you can help patients heal. That's an investment to optimal health. Therefore, we create space for patients, and I take individual care of every single one. All our doctors do that.
Yeah.
And this is what we have to create. We have to understand we're not in a stressful world, because usually when you go to dentist, it's fast, in and out. It's normal at every doctor and most of the doctors. So we do the opposite, because I don't want to bring you from a stress state into a stress state. You need to heal, and your body needs to heal, and can only heal if you're in parasympathetic.
Yeah.
If I'm stressed all day, how can I help you? It's not possible. So that's why I say we practice what we preach. We have to see it completely different, completely in reverse. And therefore, this is it's a global health transformation. It's a complete movement. It's a complete community that we're building. And it only started 2024 with the online course. And we already have, it's already 50 that are real biodentists. I have trained 1,000 already, like in Europe, or at least that had contact with me, but fully trained. This is what I can refer.
Yeah.
And then there's different levels to fully trained.
Yeah.
So this is level 5 when you hear. So that would be...
Yeah, I saw there's two dentists that were in here this morning that I've met during the course of the week that are both getting their surgery and learning and observing and watching and getting the lecture in the surgical room. And so, yeah, it's amazing to see the growth of that and to see people really leaning in, like other dentists really leaning in with a growth mindset to say, how can we change the future? And this message resonates with me as well, because I speak about this with Sherpa Breath and Cold. I don't want to do this alone. I want to be able to get many people to understand their nervous system and understand the beauty that is in breathwork and cold exposure. And you were so lovely as to have me come in and do a little breathwork session with your staff here and everything, and which is just a testament to who you are and how you vision this business, which is how do we keep the staff breathing better, feeling better, out of stress, so that they can give the energy of no stress, everything's great, we're all healing here together in the confines of your office and this work that you do. So it's really incredible.
Thanks.
I want to, so people are listening to this and they're going to be, maybe someone's listening to this and saying, I don't have a lot of dental problems right now. What are the things that you think people are missing most in their nutritional profile to keep their teeth healthy, the teeth that they have?
It's so simple, and then it's not, because actually it's an epigenetic issue. We are designed naturally, if everything's right, to have beautiful teeth that fit together, that are hard as stone. We do not have any gum bleeding. We do not have any tooth decay. We should breathe through our noses and have enough space to support even your wisdom teeth. Unfortunately, because of our epigenetics and our lifestyle and nutritional deficiencies, we grew too narrow. We are missing a lot of things. We're basically breathing to our mouth. We have tooth decay. We have gum bleeding. We have no space for our teeth. We have to take our wisdom teeth out. So this is a global, it's a de-evolution, so to speak, when it comes to our species. And Weston Price already, he's a dentist, you know that, he was a dentist back in the day. He was actually the chairman for the American Dental Association, so a high-level dentist. And he was curious. He traveled the world, and he was curious back then, how is this decay and everything connected to processed foods? Because they started in like late 1800s. So he would see all the problems coming in, and he had no studies. He just saw, okay, processed foods are coming, people are getting soft teeth. Is that all connected? So he went to see the Aborigines, went to see the Inuit and the Swiss Alps, and tried to find tribes that eat ancestral food. And what he realized was that they were growing beautifully. But their kids that had contact with sugar, refined flours, all that highly, highly super processed food that we all eat these days, that they look like little monsters. No space, bleeding gums, tons of cavities, mouth breathing, actually like our teenagers in the Western world right now, 100 years later. So he was an initial biological dentist, in my opinion, so he had an open mind. Maybe I inherited something from him, or like can bring it further. He was interested in all these things. So we have to go back to our roots, that's it. So all the convenience made us soft, and it shows at the teeth. You get soft teeth, that's tooth decay, soft teeth. And you have bleeding gums, and all the oral health issues are directly copied into your whole system. So you see it first in your mouth. If you have any sort of gum issues, tooth decay, it's nothing to do with not really a lot to do with your hygiene, because 200 years ago we had no hygiene. There was no healthcare section,
or
oral healthcare.
Or something, yeah.
No, I wouldn't even need to brush my teeth. I do that, but more for hygiene reasons, for smelling and stuff. But in nature, like I said, we are immune against tooth decay if our lifestyle is supported by being original, real.
Right, eating whole foods and things like that.
Just
and
basic.
The other topic that was so fascinating to me as a breathwork person is when I really started to think about, as babies are born, and then, where does mouth breathing really start?
Oh, yeah.
And breastfeeding, and then you were talking to me about the correlation of breastfeeding and the shape of the mouth and the function and the goodness, the oral cavity development. So talk about, because parents are out there trying to make decisions right now all the time about, both parents are working, should we breastfeed, how long do we breastfeed,
crazy.
all the things. So talk to us about the specifics of why breastfeeding can change the game for the way a child's oral cavity develops.
So again, nature has it right. We are supposed to breastfeed if possible. I know not every woman can, sorry for that, but if you can, this is the number one and the initial orthodontic treatment. It's also obviously an immune supportive treatment. It builds your baby's immune system. And because of the pulling on the breast all the time, or sucking on the breast, let's say 10 times a day, like 20 times a day, 30 times a day, your baby needs a lot of force to pull on it, and this creates a forward movement for your lower jaw, making it more strong and prominent. And at the same time, baby has to breathe through the nose, so it teaches nose breathing. It's not possible to breathe through your mouth at that time.
Yeah.
Nose breathing, and also what nose breathing all that time every day does, with the tongue correct, is it opens up the upper jaw, the palate, creates space. So it's an orthodontic treatment. I always, if possible, tell my future parents to breastfeed for at least 18 months, or even longer, as much as the kid wants. But obviously, leading up to even becoming pregnant, we help them build their body, and so that you come into pregnancy again in an anabolic state, so that you're not depleted. There are many, many women out there that tell you, oh, I lost this and this too during my pregnancy. And I'm like, oh yeah, because you had a vitamin D3 deficiency, because your body
You need even more nutrients when you're pregnant, yeah.
It's simple. Why? Because your body at this time prioritizes the baby's growth, and you're just the storage unit for it. And if you don't refeed yourself, and there's a lot of nutrients you need, not just energy nutrients, but also vitamin D3, K2, magnesium, boron, zinc, all the bone healing stuff, your body will just take it from the teeth, because teeth and bones are kind of like mineral storage. So if you're in a surplus, then your baby is also obviously more healthy when it grows up. You're probably able to breastfeed. You're probably able to give natural birth if possible, because you all support epigenetically your whole life. So it should start 1 to 2 years prior to pregnancy, that you optimize your health. And then usually conceiving is easier. Usually breastfeeding works. I can just say that from
And you
working.
know, because you have 4 children.
I have 4 children, but I can also say that because I have a lot of friends that were following our lead back then, that also have a lot of kids, and I have a lot of patients that also have a lot of kids. So I know that it works. But you have to start early, and you have to be consistent, and do not listen to the media or anything. This is still nature. Yeah. If you can breastfeed, do it, and maybe take the time. Maybe, I don't know, not everyone is able to be a stay-at-home mom, but if you could, it would be the best thing to do for your baby and the growth. And because I think just from orthodontic strength, you need about 10 times more strength from the baby's muscle and jawbone to pull on a nipple versus on a baby bottle.
Yeah.
It's just different. And imagine if you as the wife, or if you as the mom are supremely well-rounded, then you produce cream. Like, it's super nutrient-dense food that you produce. Versus if you deplete it, what can you do? Like, you cannot give the best milk. And if you also detox beforehand, have no stuff in your mouth, for example, you can just give better stuff to your baby, because it all goes through the placenta, it goes through the breast milk. So it's amazing if you can support and optimize your body before going into pregnancy.
Yeah, and that's a really beautiful point to make, is like getting the moms healthy, and if you're pregnant or you've become pregnant, it's like get yourself ready for that baby and breastfeeding.
I have one more thing to add for that pregnancy, because that is, I have a little bit of a reputation for, you
have a little bit of a reputation.
Getting patients pregnant, like in a positive way, because I have a lot of comments saying, or friends of mine that came here, or patients that became friends, they say, I blame it all on you, I finally got pregnant after seeing you as a dentist. Yeah. Because we usually found something that kept them off, like conceiving if you're in a stress mode, if your body is like chronically in stress, fight and flight. This could be from oral health issues, such as root canals, cavitations, chronically stressing you. So sometimes it was just a root canal that was chronically infected that I had to take out, and 2 weeks later, period came, and the woman finally conceived because she went into parasympathetic, beautiful state.
Oh, so their periods coming back, getting normal, having a normal cycle, then being like, okay, great, I'm parasympathetic enough now that I can
just to be aware, maybe you haven't exhausted all things before you go into in vitro or all these fertilizations. Maybe you missed the mouth, the oral health. You had dental repair. This could be the trigger holding you back. I'm not saying it is always, but it is oftentimes.
Yeah.
I could tell you 5 women straight away who had cavitation surgery and then got pregnant very soon after and tried for years and years and years. So now at this time, 1 out of 5 couples have a hard time conceiving. 100 years ago it was 1 out of 100. So it's an epigenetic issue again.
So the evolution of humankind.
That's what I mean. Just whatever is maybe chronically inflamed or toxic in your body, work on that beforehand, and then your cycle is also maybe more easy.
It's incredible. It's a really important point for women, especially. I have many friends that have been trying to get pregnant for a long time.
Yeah, that's normal.
It just took a lot of work.
It took a lot of work, but it shouldn't. And menopause is the same thing again. Menopause, if you're in a healthy, rural, more ancestral thing, you just go through menopause, there's nothing, and then you're just a wise woman afterwards. Mm-hmm. But there's not this, I'm feeling so bad, I'm having rushes there, hot rashes, and all these things that are connected to your progesterone and all the female hormones. All these female hormones could be related to your chronic stress, could be related to toxicity, could be related to your mouth. I'm just saying, don't forget the mouth.
Right.
Don't forget dental repair.
Right. Widen the perspective. Yeah, for sure. We're sitting in the Optimal Health Lounge, where I came to do a lot of the pre and post surgical stuff, and I want you to just speak to the biohacks that you've worked into this space to support people's health, because they're cool.
Thanks. I mean, all of it if possible. This is the detail work that we can just on-site even optimize further, so that you don't have a lot of swelling, not as much pain as other people experience after surgery. Because basically what we did for you is taking 4 wisdom teeth out and doing implants. Mm-hmm. Some people look like this, which is more normal. Yeah. So what we use is everything intravenous that's possible. We could do any sort of treatment here, from heavy metal chelation, but usually obviously during surgery we do something for supporting your immune system, like high dose vitamin C, there's minerals, we have it all. And even laser in your veins is possible. We have the hyperbaric there, we do the hypoxia training, we do a lot of scans also beforehand, like the global diagnostic scan.
Yeah, that to me was amazing, to be able to do a global diagnostic scan, the 3D cone scan. You put me on an in-body. For anyone who's like listening to this right now, when was the last time you went to a dental office and they were like, let's do your body composition test first, right? That's a good sign. that's something that's never happened in my life.
But I think because we're putting our patients and you on this huge protocol that starts prior with changing their lifestyle and then doing their surgery, which changes so much in your physiology that you cannot even imagine biochemistry-wise. This is just an amazing set of data and gives you kind of like an accountability. If I see, your body composition is off, you have too much body fat, too little muscle, I can now know, and they're incentivized for the surgery. That's why patients usually stick to the diet 100%, because they want the investment to pay off, right? Yeah. And then after 3 months being on a nice sort of whole foods diet, it's kind of like an elimination diet too, and after 3 months and 4 months when they come back, that's a habit now.
Yeah.
So they stick with it. We did a lot of surveys, just asking randomly patients for the last 5 years, are you still using supplements? Are you still on your diet? Are you still focusing on your protein and leaving out the crap foods? And they usually do. I mean, it's 80-20 probably, but most of them do. So
it's adherence, because they're like, they put their money behind it, they're investing, they know it's going to be the best support for their investment, and then
they feel the
create
difference.
a habit.
Like there's one patient who was here lately, she did her next in-body now after surgery being 6 months ago, and she lost 20 kilograms in that phase because she was so strict, like a soldier, and she didn't lose muscle. She didn't gain muscle because I told her you have to find a good trainer. That's the one thing she didn't do. But she stayed on muscle, but she lost all fat. And it's a lot.
Yeah.
And this is obviously a lot from stress that we relieved. If you do something in your mouth, in your central nervous system, it's basically your brain, change all these hormones, all these cytokines, your body will just naturally release water, release more toxicity, all the organs will work better in coherence, maybe your gut system starts to just produce more digestive enzymes, so it's all kick-starting, and if you then just do the right food, like support your body with real food, that's just so simple actually, then it helps, and then you heal, because I'm not, like, you go now to America and you, for the next 4 months, you heal on your own.
Yeah.
If I should give you some guidance, or at least a manual on how to stick to, because you're not sitting on my lap for the next 4 months and I can tell you, eat this, eat this, eat this, but this is the 80%. For all chronic health issues, your lifestyle and nutrition is the foundation. Yeah. And oral health is foundation, and this is what we need to bring over, that luckily people like Huberman finally talk about it, that they added into their foundations for optimal health. The mouth, it's the entrance to your gut system. The gut doesn't start here in the stomach, it starts in the mouth. And if there's something placed, or dental repair, or the microbiome is completely out of balance, it will affect the whole system. That's the only thing we bring into the table. Is not gunning for everyone, is just that part two.
Expanding it, part two, for sure. Yeah, this is the protein push is so important, I think, for people as well. It's just so many of my female clients are under eating protein, and just like the need for that is so imperative, really.
So do you give them also like 2 grams per kilogram ideal body weight roundabout?
Yeah, that's it's 1-to-1 pounds. Pounds.
1-to-1 is pound. We
pounds
do.
to grams. Yeah, but for you,
so 1 gram per
you're
pound.
on the metric system here.
We do 2 grams per kilogram is 1 gram per pound. So
yeah. So it's about the same. And when you look at the recommended allowance, they would say, oh, it's 0.6 to
2.2 actually.
For pounds, it's like 0.6
to 1.1
to 1, and I'm like, no, it needs to be 1.
Yeah.
We're just not eating enough protein, and we really need it.
See these. If you see the phase of repair like a competition, or like something we're really trained for, or like bodybuilding phases or athletes, then you need to have a surplus of the right building blocks. Not necessarily a caloric surplus, just a nutrient surplus.
Yeah, and the right nutrients, because we're
just
not necessarily
extremely
getting
important.
Those.
Exactly. You can have 2,000 calories with nothing in it.
Yeah.
But you can have 2,000 calories and you ate a lot.
Yeah.
Right?
Yeah.
So calories are maybe still king, but designing the right macros, and then skipping, obviously step 1 is always skipping the bad foods. The red chart in my food design is always no gluten, no dairy, at least no conventional dairy. I mean, biohackers do raw A2. Maybe
I did a little A2 and a little sheep. Yeah, but
that's fine.
But not a lot.
Yeah, but this already explaining this A2 dairy versus just stay away from dairy is too complicated. That's why just go off a little bit.
Dairy.
Yeah. And then no refined oils, obviously, and the classical one, no sugar. That's it. Just go with eat real food. What you can fish, hunt, and then gather maybe.
And forage.
And forage, exactly. It's super simple.
Yeah.
And then it's not, because you have to do it, right?
Because then you have to do it. No one can do it for you. If I had $1 for every client that said, but I hired you, and it's like, well, you have to do the work now too.
But you can feel it here too. I put responsibility back to you too. So
absolutely.
It's a two-way street. So it's an energy exchange actually. I also want you to do something.
Yeah.
I'm not the guy who just helps you and you just like
you want to have
do whatever.
Take personal responsibility for their health.
It's both of us, and then we have a nice success, and you are more healthy, and then it becomes a museum of life experience for you, hopefully.
Yeah, it does. It does. So you wrote the book on it, literally, all in the mouth, and I just wonder, is there another book in the future? What's that one going to be about?
I didn't really want to go a book route again, but Remy actually is on my case about that. It could be a new book or could just be...
Well, we have a mutual friend named Remy who we love. Hi, Remy, who we love, who was another referral point for me to come to you, yeah.
Yeah, he was here too, yeah. And yeah, he said maybe another book would be good. That would be more like expanding it. The last book is still about the mouth, let's say just the mouth concept, but we could add so much more to the table.
Yeah. And just expanding it for the dental community. So if you are listening and you are working in the dentistry industry, and if you're listening to this and you have an open-minded dentist, I think these are things that we can sweetly and subtly suggest to the people we work with locally.
Did you not tell me the story about this woman that was like, oh, I'm doing this for 20 years, it's so boring, the dentistry? It wasn't you, was you, right?
I'm sure she'll listen to this as well, yeah.
And this is the main thing that most dentists do. They're really, like 2 weeks ago when we did a congress, the JCCI, there was a very great real biodentist from America. She's only on the train, on the biodentistry train for 3 years, but she completely changed everything radically. She was like suffering in her dental thing. She was not fulfilled, just doing the same thing over and over again, couldn't really help patients, overworked. Really, that's a normal dental career.
Yeah.
And then she took some time off, found us, found ceramic implants, found then the whole biodentistry realm, and now she's living it and like helping people heal overall. That's the fulfilling part.
Yeah.
As well as obviously doing the tiny artist thing.
Right.
That you
and
have
maybe
to do.
more passion and love can come back for that spot because your patient load is a little less, and then you're seeing these big changes in people across the board.
It's completely different. It's a completely new game because all the patients that come see us, they are looking forward to this appointment. They know there's something happening for overall health.
Yeah.
Versus, oh no, I have to see the dentist.
Yeah.
For drilling, filling, and then billing.
Yeah, that mindset shift is.
Yeah, it's a new. We changed from technician to physician. It's a new profession. It's the future of dentistry.
It's the future of dentistry, yeah. And I met that woman at a longevity clinic at a health optimization space. So it's like finding the people who are like ready and hungry to change the game, and also are like, hey, I feel a bit stagnant, like there's more here, but I don't know what it is. And I think learning about you as a leader, and then knowing that, I'm assuming people, from what I've seen on your website, if someone's like, I want to start tomorrow, they can start with an online course and be like, okay, I'm going to take the next level and the next level and the next level. And then 5 levels in, you're here with Dr. Dome, and you're sitting in on my surgery in 6 months.
It's fast now, yeah? I mean, you compress time. I did the same. I always learned everything that I could get my hands on. Back then it was just books, there was no real internet. So I read everything from Dr. Klinghardt. Then I met him in person. And this meeting in person of the experts, always I realized I saved 20 years. So I can build on that one. Yeah. So I always look for the best in the game.
Yeah.
And then...
Me too.
You too. Thank you. And then now it's so funny to see that they tell you now, my students tell me, oh, well, now I went to see you, now it's all clarity. I've been on that train for 10 years. Like I had one Dr. Maya, real biodentist from Florida, shout out, yeah? Yeah. She just came in 2 weeks ago for her VIP day and shadowing, and brought her husband, who's the surgeon. And she told me her story. 10 years she was in the she did all the certifications that are out there for holistic, biological dentistry, every little one. And then she did mine, and now it's clarity. She said, now I know. Okay.
It all came together.
It just compressed the time to 10 years. Now I'm 10 years later, 10 years further, just with this little thing in between. So that makes me happy. And if they tell me it was the best experience that I had, this fulfills me then. Because I obviously want to give them the best experience and make them part of the mission. Yeah. And yeah.
And then you send them off and then expand into more people's horizons.
Send them off, but this is only just the beginning. It's a complete platform. It's going to be the biodentistry universe, which means we're going to create the standard for this, like on every level, because now is the time, luckily, the conventional dentists, the highest level, they accepted me too. So I'm invited at the highest level now, not to be booed at or like
having some booed at, and now they're like, yes, come talk.
Yeah, now I'm the expert speaking about ceramic implants on a regular congress. Is this the future? Stuff like this. And for really the highest professors in conventional dentistry, it's kind of like my knighting now, which I'm not always, I'm sometimes hesitant to do these speeches, but I do that because I know this will finally unite us all, because we're all the same. Yeah. I'm not a competitive guy with anyone else. I'm just there to co-elevate everyone. Build that tribe or build that community. Community is probably better than tribe because it's not It doesn't put like a edge around it or fence around it.
Yeah.
It's for everyone. But it takes time. We need more research. We need more science. Obviously, we do that. Like this is always, first is science, but then research comes next. So
Yeah.
we're just moving to the future.
Yeah, I love it.
And
I'm so thankful to be here and to be with you. I always close the podcast with 2 questions. The first one is, what, outside of oral health biohacking, what, if you had to pick one biohack that you really love, that you do often, what is it?
Me personally, for me is movement.
Great.
For me, it's just every single morning I wake up, and after 1 hour, I go into the gym or run outside. This is my grounding, basically. This is what centers me and brings all my energy in the body, and it's the only time actually that I have me time. So that's what I need. And then I can just go on with the day and do, and then repeat. So this for me is the biggest thing: movement and nutrition, probably, and nature and all these things. But and obviously my family and community. So you cannot really have one biohack, but
no, but movement is the right answer. I think it's the right answer for people to hear, for sure. And I know that you do it religiously, so that's great. And the last question I'll ask you is, if you could go back to your 19-year-old self and give yourself some advice with all the perspective and everything that you have now, almost as if you were advising a listener who's trying to look for an understanding on something, if you could go back and speak to your 19-year-old self about how to be more well as a human being in your growth, what would that piece of advice be?
For my 9, it's all going to be good, maybe. Yeah, don't stress. Because you're intrinsically motivated for different reasons. And maybe mine was like that I was always looking for like getting the praise from dad and whatever. So yeah, it's all good. And it just takes a little bit longer than you think. But if you stay consistent and true to yourself and be authentic, then it's all good. Yeah. Even though they maybe hate on you, it doesn't even matter.
Hug your haters.
Yeah, definitely. There is no... Yeah, and usually if you meet them in person, it's all good.
Yeah.
They just didn't really understand it. Maybe it was a wrong sender and I didn't get the right message out.
Yeah.
And even, I mean, in these days of social media, they scan through snippets. We will probably have some snippets from that podcast, and then it's probably one that is a little bit more catchy, and then it could trigger someone emotionally, even though they didn't listen to the full episode. So that's how these things are created. You have to get the full picture, and then there's solid science behind whatever we do here. It's not just a woo-woo thing, and we don't play the, what is that thing that you said?
Singing bowl.
We don't play the singing bowl, even though I like sound healing. Yeah. So this was my goal. I wanted to have something, a concept that I can explain to a very skeptic medical doctor on every level, to the last bit. You can ask me questions. I try to answer it all. And if I can't, I find the answer. And this is how all my friends from university came at one point and said like, okay, it's working, I'll do that. And I understand, it's not religion what you're doing, it's really science-based, but you have to learn so much. And now it's easy because I just compressed all the learning for everybody. It's super simple.
Beautiful.
And then building from there all the different things that I'm trying to do and aligning it all, because that's actually my main thing, just building, creating different things, the DNA, the Optimum Health Launch, all the different...
Yeah, well, it's pretty legendary to be here. So thank you so much for, the 10 days I've been here, the experience I've had with you, it's interesting to me to thank someone for being like, thanks for going into my mouth and doing all this dental work and surgery, because I have had such a crazy experience in the past, but I feel changed as a human being by coming here, and the way that I process trauma and the way that I feel about my mouth and my oral health. So thank you so much for being here and letting me be a part of all this magic on the mission.
Thank you for being here too, and being part of the mission.